Hi there, I'm Dr. Jean-Marc Slak. And one of the questions I hear often, and I've read about it recently on Facebook, it was regarding whether x-rays are always necessary when you go to a chiropractor, are always necessary to start chiropractic care. Well, the reality is that like everything else we do in the chiropractic office, like everything else we do in my office, the answer is dependent on what your needs are. There's no universal one size fits all. Whether, we have people who come in who are in their 80s. We have people who come in who are in their 30s. We have people who come in who bring their babies who are newborns. And I tell you what, the needs and the recommendations are going to vary greatly from one person to the other. So for most people, once they've had the opportunity to have some damage in their spine, we want to know what's there. It really just makes sense. It's just safe, it's reasonable, and it allows us to measure progress. It's very, very important. So for a lot of adults, we're going to be taking x-rays. In the case of babies, we never take x-rays. In the case of children a little older, unless we're suspecting a trauma where there would be a fracture of a bone, or we're really looking for a scoliosis or massive distortion that we need to track and measure and that we need to have an impact on because it's going to affect their health, their well-being, and their appearance, then we're going to take x-rays on those kids. But that's rare. That's the exception, not the rule. Most adults, they have a history. They have a history of trauma. They have a history of poor posture. They have a history of problems that is only reasonable to make sure we give them the most appropriate care, the safest, most effective way to get from where they're starting to where they want to be, to resume the activities that they want to perform in their life. And x-rays are going to enable us to assess what's going on very precisely so that we can have the most effective, fast and efficient care recommendations. And so we can also measure results. Results are important. Not only do we want our patients to feel better, we want them to also function better, and we want them to maintain that higher level of function over a period of time past the period of intensive care. For these reasons, x-rays are really great. They're a great tool that give us an objective measure of progress. So the answer, do we need x-rays? Sometimes we do, sometimes we don't. But it's really important that when you do need them, you get them. Hey, I'm Dr. Jean-Marc Slak in Burlington. I can't wait to see you.